medical practitioner. I'm a holistic practitioner. It means I'm concerned about the mind and the body. It's a mind-body medicine, but everything is natural, supporting the body to ready for the body to work well for you. Right. So that is my concern. That is the area I operate. Good. Now, poor blood circulation is the topic on the table now. So what is really poor blood circulation? When we say that poor circulation can be defined or is defined as an inadequacy. It means that it's not enough. Inadequacy of blood flow to a certain area of the body. A certain area of the body. So it could be your brain. It could be to the extremities. It means your feet and your hands. It could be to the digestive system. It's not getting there. So it's a poor circulation. And always you got to understand that the blood flow, the purpose of blood flowing in your body is to carry oxygen and nutrients. The nutrients that your body extracts from the food you eat. It means the minerals and the vitamins and the enzymes, the hormones. They are in the blood. Of course, and your white blood cells, your red blood cells, your platelets, all these are the composition of the blood, of course. That gives you the life that you have. So it means that this blood should be able to flow freely in your body. Unfortunately, this doesn't really happen in many people because of the fact that they even don't know that they have a reduced capacity of blood flow. You see, the amount of blood in a human body is about 5 liters. 5 liters of blood that should consistently flow in the human body. It should, you see, out of this 5 liters, let's say 5 liters is equal to 100% of the blood capacity. The brain alone needs about 30%, and the 70% left, the rest of the body will share. So it means, what is the point? Our brain needs a lot of blood. So when you have a poor blood circulation, which organ will suffer first? Your brain. Your brain will suffer a lot, and you wouldn't even realize it. It will take some time. When you start forgetting, when you start losing concentration, then you realize that something is going on, because you don't even understand. You may think it's because of aging. Because of aging, that's why you can't remember. Don't connect forgetfulness with your age at 50 years old, your age at 60 years old. Don't connect or don't link it with that. It's because your blood is not flowing beautifully in you to get to the brain. And normally poor circulation is felt in the extremities. When I talk about extremities, I'm talking about your arms and your legs, specifically the fingers and the toes. You will experience this numbness, tingling, pins and needles. We will come to the signs and symptoms very, very soon. But you see, now we begin to understand. I believe we're getting somewhere about poor circulation. You see, the circulatory system consists of 3 independent systems that work together, and that is your heart. Your heart is a pump that pumps blood to go through another circulatory system, that is the arteries and the veins. In fact, when you put the arteries and the veins together, they measure up to about almost 100,000 kilometers. It means specifically in miles is 60,000 miles, and in kilometers is about almost 100,000 kilometers. And it, just for you to imagine, it's like going around the world twice or more, a little bit more than twice. And that is in you. It's also the circulatory system. So this pump, this heart, that we have, it should be strong to pump, to go through the arteries and the veins, to supply you. And of course, another independent system is the lungs. The lungs. So your lungs should be active. It should expand to draw in the oxygen and release the carbon dioxide. So it's very, very important. Although these three are independent, but they still work together. The body is intertwined, is connected, directly connected to each other. And that when they work together beautifully, you will never suffer really serious health consequences. That is the whole thing. You see, why is blood the life of the flesh? Our blood contains red blood cells. The red blood cells that is responsible. In fact, red blood cell lives for about 4 months. Red blood cells that carries oxygen. Its responsibility is to carry oxygen. Red blood cells contains what they call the hemoglobin, and the material needed to make hemoglobin is iron. That's why when your iron is low, your oxygenation becomes poor, and the person also suffers from poor circulation because of the iron. Because iron is the makeup of hemoglobin in the red blood cells, and the blood contains white blood cells. The white blood cells, they are responsible to fight against what? Diseases. They fight against viruses, bacteria, fungi that gets into the body. Your blood contains that. And then your blood contains platelets. Platelets are the cells that are responsible for clotting. So if you have a cut, platelets will come together to form a plug, to plug the cut so that you don't bleed to death. And platelets live for about 7 to 10 days, and the body produces fresh one. Somebody may ask, another part of the blood is plasma. This is the liquid portion of blood. For you to it's for your point of interest only. For you to know what is flowing in you and why we should take care of it. You see, where is blood produced? Blood is produced in your bone marrow. The bone marrow is that spongy, soft spongy material in your bones, and that's where we have the production of the cells, the blood flow. So that's why it's in fact, that area is just every tissue, like every organ. So they also need good nutrients from the very food you eat. They need also good circulation. It's a cycle. I hope we get in some way. We get in a picture of poor circulation. Now let's come to the symptoms, the signs, how you will know that you have a poor blood circulation. The signs and symptoms. But let's get those numbers on this platform. Let me put these numbers. Maybe you're suffering from poor blood circulation. Maybe it's not you. Maybe it's someone else. As a gift for the person, share this number. And you'll be a blessing to that person. And in turn, God will also be blessing you. That's how it works. Life itself is a cycle. And when we realize that blood flow is also a cycle, the same thing. You bless someone, you're also blessed. Share this number. If you're calling outside the UK, it's +44 738 464 7300. You're calling within the UK, is 0738 464 7300. And the second number, +44 745 988 9152. Calling within the UK is 0745 988 9152. Share this number and be a blessing to someone. Now let's come to the symptoms of poor circulation. So how do you know, believers? Or, just how do you know, lovely listeners, how do you know that you have a poor circulation? The first thing is a numbness and tingling in the hands and feet. So you'll be experiencing a sensation of pins and needles. Although, of course, if the nerves are affected, if you have diabetes, and that diabetes is damaging your nerves, you can also experience pins and needles. Anyway, diabetes is one of the main causes of poor blood flow. And diabetes thickens your blood in a way, so it can also cause the pins and needles without even the nerves being involved here. So, tingling, numbness, and pins and needles, that is number one sign. You see, number two sign here is cold hands and feet. So if you realize that half of the body is a bit cold, let's say your feet, one foot is cold, the other one is warm. Maybe both hands are cold, and part of the body is warm. You got to know that you have poor blood circulation. The capacity of blood flowing in you may have or might have reduced by 50% or 40%. So you are like living dead person. If your capacity of blood flow in you is reduced by 50%, we have some people like that. They are nicely dressed, walking around, maybe dancing and so on, but they are running on 50% blood flow, which is very, very serious. The next sign is swelling in the lower extremities. When I talk about lower extremities, I'm talking about the feet here. So the swelling normally around the ankle area, we call that edema. Of course, if the heart is getting weak and the kidneys are getting weak, you may experience the same swelling. But if you have a poor circulation because of weak heart, you can also have the same problem of swelling around the ankle. So you press it. When you press it, there's an indentation. It gets in. It doesn't pop back. It's swollen, telling you that something is wrong. You have a poor circulation, and maybe your heart is weak. Maybe arteries are plugging, become narrow, and there's a limitation of blood getting around. What else would you see? Cognitive dysfunction. Now, when I talk about cognitive dysfunction, I'm talking about the brain. That is when people start forgetting, and they associate or they link it with age. Your doctor, if you're not careful, will tell you you're 60 years old, so it is normal, and you accept it. Change your mind to have new life. If you have accepted that, please today decode that. Remove it from your mind. Because of you're 50, just 50 or 60, you are forgetting. Because you've had poor circulation over the years. So your brain hasn't been receiving enough nutrients and oxygen. And so your brain is shrinking fast. It becomes smaller more quickly than necessary. Already with age, we all have the brain shrinks gradually with age. But you see, the speed at which it shrinks can be reduced. I'm talking about the time. You can reduce it by 20, 30 years. So, if you are 190 and you start forgetting a little bit, it's not a problem. But when you're in your 60s, 50s, 70s, and you start forgetting, and you can't concentrate, you're losing your mind. This is very, very serious. Very serious. So, and then apart from that, there are brain disorders like dementia, Alzheimer's. If somebody is impacted with Alzheimer's, they don't recognize even the people around them. It's not life. And then Parkinson's disease also can come in. So it's not about, it starts gradually. Forgetfulness, concentration, and then other more serious cognitive problems also come, like Alzheimer's and Parkinson's disease and other brain disorders. The next sign is digestive problem. Somebody going to ask, doctor, why digestive problem? Poor circulation. You see, anybody, when we all eat, the brain actually controls everything. So the brain sends everything, the blood, I'm talking about blood, to your digestive system to help you digest your food and get your nutrients. It's very important. But if you have poor circulation and you have reduced amount of blood getting into your digestive system, you can't get your food digested well. And so you will have chronic digestive problems, indigestion. So when you finish eating, you feel that your belly is protruded, is bloated, you're passing gas, flatulence, you have sometimes diarrhea, you have constipation, you have abdominal pain, sometimes you have blood in the stool, you have cramping, So all these are symptoms of poor digestive health. But you know what? There's something even more important to understand here, to listen. If you have poor circulation of blood to your digestive system, what happens is this. There's accumulation of fatty matter, of fatty substance that collects in the lining of blood vessels in the abdomen. Fatty substance will be collected in the lining of blood vessels in the abdomen. So what happens? You will see that your abdomen becoming bigger, and you wouldn't even understand, both men and women. It happens. So you may have a protruding belly, and you may think it's because you are fat. No, because you have poor circulation. Fatigue is another one. You feel tired all the time because you have poor circulation. Oxygen is not running in you well. Joint pains, muscle pain, pain here and there. You see, another sign is skin color changes. Because we're dark, you may not understand, but if the area is darker, then you know that it's a poor circulation. There are some areas that are very clear, like the nose, the lips, your ears, your nipples, your hand and feet. They can get darker. But especially in the leg, if the person is diabetic, especially and has a problem like peripheral artery disease, it means the blood flow to the leg through the leg is reduced. You see the color of the skin of the leg is changing. It's darker. It means that there's a poor blood flow in there. If you have this problem, don't sit and call Dr. James, okay? Because help is around for you. Don't suffer. Don't suffer, and don't let anyone that you know, you love, a friend, loved one, suffer in vain. Because the solution to these problems, leg ulcers. So if it is especially in diabetic condition, leg ulcers develop. That's why somebody may be controlling the blood sugar, but they have leg ulcers, gangrene, and they have their leg amputated because of poor blood flow. Varicose veins. Varicose vein can cause the existing varicose vein that is not visible to be visible. So you see the vein so visible on the leg. And when you go to the hospital, you are recommended to wear compression socks to compress. That is management, so that the blood can get back. You see, the main problem in varicose vein is that the walls of your vein is weak. That is the main problem. So you need to restore the health of your veins, and then blood will run through beautifully and come back to your heart for the cycle to start again. Simple. Not the time to be wearing socks, compression socks. It's not fashion. Dry skin is another sign of poor circulation. Dry skin. Sometimes the liver could be involved here, but dry skin is because of poor circulation. Loss of appetite because of indigestion. So you may not have appetite. You ask your blood that is flowing in you. Dizziness, headache, and migraine. Sometimes the headache and migraine could be the liver or gastric problem, but poor circulation is a factor here. And then weight problem, because when you have a poor circulation, you have a slow metabolism. This is the body's mechanism to break down fat. So if you have poor circulation, you can break down the fat. So you put on weight. So weight gain can be a sign of poor circulation. And then frequent infections because you have weak immune system. If your immune system is weak because of poor circulation, you'll be getting infections all the time. Hair loss and brittle nails. The liver could be involved here too. But poor circulation can lead to that as well. Erectile dysfunction. A man, especially from 40, they have problem to function with their wives. It's because of poor circulation. For a man to be man, there must be enough blood getting to the pelvic area. But the women, what happened to the women? They lose desire. They are dry within. They are dry, and they don't have any sensation at all. So they have sexual intercourse with their husband, but they can't feel anything. They don't enjoy anything. They're even afraid to have this encounter. But it shouldn't happen. Poor circulation can cause that. Then tightness, heaviness on the chest, pain on the chest sometimes. It's on and off. It's called angina. And then difficulty breathing, especially when you go by stairs. When you do something demanding. You walk by stairs, you go uphill. You feel tired. What causes this? This poor circulation. A condition called atherosclerosis. Your arteries, not the veins. Veins don't plaque, but arteries. They plaque. They become narrow and stiffer. But we can clean it. You can have them cleaned. Clear the arteries. But they cause that. That's the number one problem. But when you have arteries plugging, your heart also become weak because your heart will be overworking. And when the heart is weak, it can't pump well. And you can have the same problem. Blood not getting to the brain and also around. Diabetes is one main factor. Also, if you are diabetic, sometimes people even don't know they are diabetic. They have pre-diabetes. And they may have pre-diabetes. It can cause the same problem as normal diabetes. It thickens your blood. It contributes to plugging of the arteries, which reduces blood flow. Blood clots, which is not too common, but it can also be a cause of that. Being overweight can reduce your blood flow. Renal disease or renal phenomenon. This is also a disease which can make the small arteries in your toes and hands, get tightened, especially when you expose yourself to low temperatures. You see, all these signs I have told you today, you may be worried about them. But you see, the most serious consequences or complication can be stroke. It can be heart attack. It can be sudden cardiac death. The individual will be walking and fall and die. Or maybe sitting down and fall and die, or die in the sleep. We call that natural, it's a natural cause. That's what happens. Because the heart stops beating. That is more important. And then Alzheimer's, the brain disorders like Alzheimer's is becoming very, very common in the Western world. Alzheimer's and Parkinson's diseases. It's not even. There's no cure in the standard treatment. When you go to the hospital, they will tell you, why do you wait until you have that problem? Why don't you just a call away? A call away. If you have a poor circulation, don't waste your time. Call to have your arteries clean up, your heart strengthened, your blood clean up, and your life will never be the same. We shouldn't just survive making a living, but we should make life. You have the choice to make today. Give me a call, and your life will never be the same. Go to YouTube, put in Dr. James Natural Link, Dr. James Natural Link, and share those presentations. Subscribe, and press the like button to support this program. Thank you very much for coming around this platform to support the program. May God bless you, and I look forward to having another good time with you next Sunday. Goodbye for now.
Trade these ashes in for beauty, and work forgiveness like a crown.